Medical on Today, sponsored by TheaPamex.
Now, we all know it's important to get our eyesight regularly tested, but it's equally important to look after our eyes from a hygiene point of view as well.
Nikolina Budimlija is with us, and she is a consultant ophthalmologist. Doctor, you're very, very welcome to the show.
Thank you.
We always talk about taking care of our eyes. We have only two of them, so we really need to mind them, don't we?
Very true. Thank you for having me. Yes, exactly. So first of all, our eyesight is very important. So basically, if we just don't take care of our eyesight and vision altogether, it can do a lot of damage and sight impairment. So basically, it is very important to take care of our eyes, the health of our eyes, and just to do the regular eyesight test. So that's how we can prevent any further damage or any ocular surface or even other damages inside of the eye.
So I would have contacts, so I have to get eye checks for them on a regular basis anyway.
Exactly.
But for a normal person, who doesn't have contacts or wear glasses in general, how often should they be going?
So at least once a year, I would say, do the normal eyesight test, and then your eye care professionals will dilate the pupils, have a look at the back of the eye as well, look at the front of the eye, and that's how we can detect if there is any medical problem there.
And doctor, at what age should you start taking care of your eyes, or should you have been doing it all along? Because I'd imagine now, say, you only go to an ophthalmologist when, okay, I'm having problem with one of my eyes.
Exactly.
When should we start taking care of our eyes?
Exactly, that is true. So I would start at as early as possible, so at the age of 4 or 5.
4 or 5.
Exactly, just to see if the child has any sight impairment, you know. And if we do detect that, something can be changed by the age of 7. But if usually people are not going to the eye care professional until they have some sort of the problem. So that's the problem, actually.
That is the problem.
How much of an effect would your lifestyle and your overall health have? What impact would that have on your eye health?
A lot. So as we know now, after the lockdown and everything, the people are working more from home, and they're actually spending their time more on computer. So if you are looking at the computer, at the screen, 8 to 10 hours a day, you are basically blinking less. So you are having a more dry eyes because the tears are evaporating much more quicker. Okay. So we should have smaller breaks, and we should have, as we call 20-20-20 rule. So every 20 minutes, look at something that is 20 feet apart for 20 seconds. And it really does help.
What does that do? Does that refocus your eyes or your brain?
It kind of eases this strain. It gives you no headaches, and it definitely keeps the eyes to blink more. So that's how we can lubricate additionally the surface of the eye. And then again, you have people who are working in dry, heated areas. Exactly, like factories or air conditioning. Our farmers working outside with the pollen dust. And then again, as we said, kids working on mobile phones a lot and spending their time.
See, that's the thing. You're on the computer all day,
Yes.
and when you take your break, it tends to be like what's happening on social media. And you're like, that's the exact
And we don't
opposite of
think
what you
about
should be
our eyes at all, But if we just take those 5 minutes per day, and then we maybe just pay attention a bit more, and we should as well clean our eyes, because as you said, we only have 2 eyes. We clean our teeth every day, every morning, every evening, even during the day. But we forget to clean our eyes as well. So that is also very important.
The only time I do that is to get my makeup off. Literally, it wouldn't even occur to me to do anything with them otherwise.
I wouldn't even know where to start to clean your eyes, to be honest.
Well, you know where they are.
I know where they are. Okay, that's a good start. Yeah, but as in, how would you go about cleaning your eyes? And I'd be afraid. See, I'm just afraid to put something into my eye that I might hurt myself, or put something that shouldn't be in there.
No, you can't hurt yourself. But basically, it is very important. Each morning and evening, use the wipes, specially designed medical device wipes, such as, let's say, Blepharitis, and then you can just slowly rub the area in between the eyelashes, and then that's the area that we can clean, because we have the bacteria, normal bacteria and mites actually on the top of our skin that are usually
mites?
There. Exactly, mites.
Do we all have mites?
We have mites. So in certain medical conditions, you can have the infection of the eyelids, which is called the Blepharitis. So there are also different types of Blepharitis, but in the end, if you do have this kind of medical condition, thickening of the eyelids.
Of it there.
Exactly, you can see that on the photo.
This is very common, I think.
It's very
Nikolina.
common. So I would say that 40% of the people above age 40 have the blepharitis.
Okay.
So this is very important. So even if you don't have the symptoms, I actually had a patient, she was very nice, and she said, I have just a little bit of gritty eyes, maybe a little bit red eyelids, what's wrong with me? And then I look at her at the slit lamp, and then I saw that she has actually the blepharitis and the little mites.
So if you started picking at it with your finger, if it starts to irritate you, could you spread it?
So you won't spread it, but the mites are actually on the edge of the eyelids, just on the eyelashes, the follicle of the eyelashes. So they are feeding themselves there. So that's the area that we should clean our eyelids, okay? So use the wipes and then slowly rub the area in between the eyelashes, not only to take out the makeup, but we should also do it in the mornings as well, not only in the evenings, because that is maintaining our eye health as well.
But some of the stuff that you use now for taking off mascara,
that
you use,
yes.
right? Like, I'd imagine that could be fairly tough on your eyes, could it?
Some of it can
exactly.
actually.
It can be very tough. So also, it's not a problem wearing mascara. All women should have one, but
there's a happy Sinead.
but we should definitely think about not only removing the mascara, but cleaning the area in between the eyelashes. And then again, this is not the condition that affects only women.
Yes.
Men are also the one who should take care of their eyelids. I know men don't think about the eyelids and the eyelashes.
I have a reputation to mind and to guard.
Exactly, still have eyes you need to mind, though. That's the thing.
Very true.
And this is
From tomorrow, Dahi, you will start cleaning your eyelids and eyelashes.
Listen,
yes, ma'am.
What about COVID? Has that affected anything, doctor,
Yes.
and how we, I don't know, look after our general health, obviously, but with our eye health at all?
It affected us a lot, I would say, and I think that the patients are a bit more aware of their general health. At the Institute of Eye Surgery, actually, we are very proud that we could give this 24-hour urgent access to the patients who are emergent, let's say so, and then on 3 different locations throughout the island, they were able to have this service. But I would say, yes, they are definitely more aware of their eyes. Some of the regular checkups have left unfortunately untreated, but this is something that we need to take care of.
We have around 10 seconds left. Quick question here from Kiera from Dublin. Can what we eat cause blepharitis?
What, sorry?
Can what we eat?
What we eat, yes. So some type of food can cause blepharitis, such as processed fried food full of grease, fizzy drinks, white flour.
How am I getting away with it so? Because that's my
sugar.
stable diet. Like
a lot of healthy food full of fruit and vegetables.
And water, loads of water.
Lots of water to keep us hydrated. Exactly.
They're the constant things you're told to do, and none of which I do. But I'll start now. Thank you.
Dr. Gurumila, thank you.
Thank you so much for
Thank you for having
Dr.
me.
Nikolina. I really appreciate it.
Thank you.
I have a lot to do. I have to scrub up, as do you, as by the sounds of it. But
Don't
anyway.
be trying to throw it over to me, you know. Oh, yeah. Don't be deflecting it
You're the
over
one
to
who
me.
said you didn't do anything about your eyes. But anyway, as always, if you have any health concerns, do consult your GP. And if you want any more information on today's topic, then head over to our Facebook page, RTE Today.
Medical on Today, sponsored by TheaPamex.